So is the biggest threat to Medicaid more, you talk about the Republican House proposal, but the block grant proposal, unless I'm wrong, it doesn't seem like it's going to anywhere close to becoming law. That the biggest worry is not about the Republicans, it's about the Democrats may decide to cut Medicaid.
I worry about that too. I worry about everybody when it comes to Medicaid. But there isn't the passion because the Medicaid population doesn't represent the threat. It represents an enormous moral values threat, I think, to honor in public service people. But it doesn't represent a political threat or a financial threat. Medicare are seniors and they all vote. And Medicaid tends to be disabled, people who are less likely to vote. They certainly don't have a lot of money. They don't have any lobbyists. They have some terrific people in town and in each state who fight for them, but they don't have the power. A 10-year-old boy is out playing on his bicycle on a street and he gets hit by a car. It damages his spine and he's in a wheelchair for the rest of his life. Is Medicare going to take care of him? No. Is private insurance going to take care of him? No. Medicaid is the ultimate American safety net. Medicaid will take care of him. That is an expensive care. So you have to decide, compared to all the tax cuts for the rich, the tax cuts for the oil companies and all these others, and people who pay no taxes whatsoever, corporations who pay no taxes whatsoever. Do you think about the little boy who through no fault of his own will never walk for the rest of his life, and yes, his health care is very expensive? Or do you also think about what all these people are getting away with? Because the people who have a lot of money and are really big, all they do is win. They never fail. They always prevail.
Let's look at it from the governor's point of view. You were a former governor. Governors have been lobbying Capitol Hill, complaining their additional stimulus money under Medicaid is going away this month. Revenues haven't bounced back. The economy hasn't bounced back, and Medicaid rules we know have increased. They want flexibility, and they would like to be relieved of the maintenance of effort. I know you disagree with that, but is there some merit to their argument that they need some relief on Medicaid?
I don't know. We'll see. I won't negotiate against myself.
No, I don't want you to negotiate, but just from the perspective
just to take the maintenance of effort, and most people, that's a hard thing to understand. But you've got to keep standards.
Right.
Healthcare standards have to stay the same. If you relax maintenance of effort, if you relax the standards that states or the governors of states have to make sure that is kept for their people receiving health services, then one thing will happen within weeks. The children's health insurance program will disappear, and millions of children will lose their health insurance and will be put into the exchange market. It's just like if you handled Medicare the way the House Budget Committee wanted to, those people would go from being on a good health care program to being put on the street to fight against with insurance companies, and they would end up paying $6,400 more than they do now for less good health care.